Today we're going to talk about arthritic bunions or hallux rigidus. I'm going to show you what a normal bunion looks like. In a normal bunion, the first metatarsal, which attaches to the big toe here, will sway outward, and then the big toe will go inward. As you can see, it's a very rounded head of the first metatarsal, and because of biomechanics or the way people walk, the muscles on the inside of the toe pull the big toe this way, and because it's a rounder head, the first metatarsal will splay outward as the big toe goes inward. This is a bunion. This becomes prominent. When you have an arthritic bunion, people are born with a squarer or a squared off type metatarsal heads. And the same biomechanics or the same way you walk causes the arthritic bunion, or what we call hallux rigidus. So here is an example of a gentleman who was born with a squarer metatarsal head, and over years of exercising and being on his feet, working many hours per day on his feet, the joint becomes arthritic. As you can see here, you can hardly see any joint there at all. If we turn the x-ray to an oblique view, we can see how much arthritis or how much spurring we have on the big toe joint. This is a side view of that same area, and you can see the spurring or the arthritic changes on top of the big toe joint. Usually these types of patients will come in and say they're having problems fitting their foot into the shoe because that spur is too high and it rubs on the top of the shoe. They also complain of the inability to move the joint, or the joint is not moving properly. Some people actually function differently or compensate for that, and they start to have things like ankle pain, knee pain, hip pain, or even back pain for this. There are different treatments that we do from this, ranging from using stiff sole type shoes to making them a pair of biomechanical orthotics. Those treatments will not get rid of the problem, but they make it more tolerable. There are cortisone shots that can help with this, and there are anti-inflammatories, something like ibuprofen or naproxen, that can help rid the patient of some of the discomfort, but all of these are temporary type fixes. In certain people, when the bad days outnumber the good days, surgery is something that is considered. For this type of patient, there are basically different types of surgeries, or three of them, that can be done. One of them is to remove a portion of the joint and to put in a celastic or a plastic type of joint or a metal type of joint. Another one would be just to remove a portion of the joint and have a space in that area. There are many reasons to do these procedures or not to do these procedures based on the patient's health, activity level, and other conditions. The type of surgery that is done very often, that's been done for many years, is an arthrodesis, or a bunionectomy with a fusion of the first metatarsal phalangeal joint. What that means is we go in there and we remove a portion of the arthritic joint, and then we stiffen the arthritic joint. So that gives us the ability to walk in like a teeter-totter effect and do anything that you want to do once it's healed. If you are a runner, or if you do aerobics, or if you're just a walker or a stay-at-home sedentary type of person, this seems to be a very good choice for surgeries